Welcome back to the All Things Plastics podcast. Today, I'm joined by a very special guest, Anni Kim, a 32-year-old celebrity plastic surgery nurse based right in the heart of Beverly Hills, California. Not only does Anni work alongside one of the most sought-after surgeons in LA, but she also is no stranger to the operating room table herself. From navigating 3 rhinoplasties to undergoing her second breast augmentation, she has experienced the highs, the lows, and the lessons that come with multiple procedures. In this episode, we're diving into her personal journey from body dysmorphia and mental health to dealing with trolls online, regret, and ultimately learning how to find balance in the world of beauty and transformation. Everyone welcome Nurse Anni Kim to the show.
Yay! You always make me sound so cool.
Yes, girl. Oh my God, wait, I have to let everyone know that we have filmed this podcast before, what, 6 months ago?
Yeah, like a while ago.
A while ago. And you were at home, the vibe just wasn't right. Your poor dog was just going through it. And then we met in person because we were only chit-chatting online. And we met in person. Where did we go? Did we have drinks? Did we have dinner?
We went to Yamashiro, or the downstairs of it. And
Yes.
then we just vibed and we just clicked really, really
Yeah.
well.
I was like... Anni was like, actually, I was so nervous doing the podcast. And then I met you in person and I wish the chit chat was like how it was in person. And I was like, yeah, girl. And you were like, let's redo it. And I was like, okay, we can redo it because we're more comfortable now. And girl, you just got your 3rd rhinoplasty and 2nd breast aug.
I know. It's I'm glad that I did it, but I'm not glad that I had to do it again. And that's what I think people don't understand. It's not like I'm doing it by choice. Does that make sense?
Yes, I feel like the trolls online, because you are only 1 week post-op, and the trolls online, people are thinking that you're doing it because you just wanted to get a 3rd rhinoplasty. And it's like, no, reality check. We needed to fix some things.
Yeah. And it's a lot of it too is I just don't want, and the reason why I'm so transparent about, my surgeries and everything is because I don't want the same thing that happened to me to happen to other people in regards to, going to doctors who are not even real plastic surgeons.
Oof.
That's a whole nother issue.
A whole nother issue that we're definitely going to dive into.
Yeah.
But before we get started, I want to let everyone know the context right now. Anni is back at work. She is 1 week post-op, and today's her first day back at work. And she's still wearing. Are you taped or cast? I can't see.
I'm just taped right now. The cast came off yesterday, so I'm just taped. I stopped my pain medication yesterday, and so now I'm just on Tylenol and just treating it that way. So the majority of the pain and discomfort is gone. It's just like you hit your knee or something and just recovering the swelling.
And she's doing a podcast while at work, while recovering. Iconic.
I can't sit still. I was getting so bored at home. I was like, I just need to hang out with everyone I work with. They feel like family. I'm like, I want to hang out with my friends, go back to work.
Yeah, you're kind of get tired of just being laid up, not doing anything. And, you are 1 week out. You're at work right now. How are you feeling? I know you're back on Tylenol. How's your energy? Are you back to eating? Are you drinking your liquids? Are you taking care of yourself?
So we have, luckily in my office, had a hyperbaric oxygen chamber. So I'm going to do that, which will help with the healing a lot. Just very kind of light stuff. I'm doing more shadowing our surgeon and just learning more from him right now. And then just doing some social media, things like that. So nothing too crazy. Still keeping it light, especially because my first breast augmentation, I went to work really early, which I think is why I had developed a capsule on one side because I didn't let it heal correctly. So that it doesn't happen again, I really am taking the post-op care more seriously this time.
Yes. It's so funny, girls out there, they think a rhinoplasty is really easy or it's just a breast aug. It's fine. It's a small surgery. And then they get some complications, whether they're minor or they're major. And then they have to get a revision. And then it's always the second time around, they're like, okay, I'm definitely going to follow all the rules this time. And it's girl, you should have done that from the jump.
I know. And I'm a nurse too. And nurses are the worst. You just have to learn from your own mistakes. And so, yeah, I definitely am doing that and taking it a lot lighter now.
And you got your 3rd rhinoplasty and your 2nd breast augmentation with the famous board-certified Dr. Jay Calvert in Beverly Hills. How is this recovery different from your first 2 rhinos and your first breast augmentation, especially since it was a revision?
So my surgery was supposed to be only 6 hours. It ended up being 10. Because of what they found, when they opened and saw everything. Because you can't see, you know, when you're doing you can only kind of see the outside when you're doing the pre-op. But it went longer than they expected because of just all of the issues that, they found. And again, this is why you really need to go to a board certified plastic surgeon and not just some random doctor who just goes to a weekend course on, breast augmentation. doing things. And yeah, I remember waking up and I was like, it's dark outside. Like I thought we were supposed to be done. It was kind of, it made me upset because, luckily I work in this industry. I also work with Dr. Calvert and he's amazing. And
Mm-hmm.
I'm lucky I have those resources, but not a lot of
Yes.
people do. Like this is
No.
expensive. Like this stuff is expensive. Like it's a lot of money. And so to, waste your money and then, put your trust into someone who isn't even a real plastic surgeon is just, I just think it's fraud essentially, right? Like it's not right.
100%. And the fact that they can still put people on an operating table and perform these procedures. And I want to dive into your first and your second rhinoplasty. Where did
Mhm.
you get those done? And was it board certified? Were they not board certified? Tell
So
us all the tea, girl.
I know. So with that one, I can't say too much, but it was in the US
Okay.
where I got my nose done. I think I found, and this is why I tell people, I'm like, never use Real Self. You know, that app. Yeah, I'm like, never use Real Self. The 2 times I've used it, terrible. And I thought, I mean, he was really nice. And, I think he tried his best and he just wasn't able to do it. And then even with the revision, it was a little bit better, but still just wasn't able to do like what he needed to do. And so I kind of felt like I was at a loss. And then when I started working for, one of the best like rhinoplasty like surgeons in Beverly Hills, he's like, no, like I can fix that. And
So
so
you had full trust. You found a surgeon in the US
Mhm.
and he did your first and your second. He did your revision the second time and you still were not happy with your results.
Correct. Yeah.
And the only form of research you used was Real Self, or did you try to utilize anything else like TikTok or Facebook or YouTube?
Well, that's the thing. It's hard to find people that are willing to talk about, their experience. And that's
Mm-hmm.
why I talk about my experience. It's like talking to a girlfriend, like
Yeah.
a referral that way. And a lot of people don't have those girlfriends that they can talk to. So that's why I do talk about those things.
Yeah.
But, I'll look on Instagram or I think I looked on Yelp too. This was maybe like 3 years ago.
Mm-hmm.
So, I mean, social media was there, but it wasn't as
Prevalent.
big-ish kind
Yeah.
of. But yeah, it was just like Instagram, Google, like Real Self, like that type of thing. But never from anybody that had surgery from them.
Yeah.
And then just one thing, because I don't want to forget to say
Mm-hmm.
this, but when you're shopping for a surgeon and they're showing you their before and after pictures, like make sure to ask for like 1 year post-op photos and like the 2 year, the 3 year, to see how it progresses because things change and then
Shit
with the
changes over
healing.
time. And it takes like almost 2 years to get your final rhino results.
Right. So you want a surgeon who's going to give you a result that's going to last you,
Mm-hmm.
your whole life, basically.
Yeah. Now, when you picked your first surgeon to do your first and second rhino, did you know that they were not board certified, or did you not mind, or were you not even, that wasn't even on your radar? You were just looking at the results.
It wasn't on my radar. I think I just was a little naive because I'm just like, I assume that if someone is performing plastic surgery, that they're a plastic surgeon and,
And
they are.
that's fair. A lot of the general public or someone, working not in the healthcare field, they assume, okay, this licensed professional is doing plastic surgery, so they must be certified or, so a lot
Mhm.
of women do assume that. And that's why we're trying to, raise awareness and tell people like dermatologists can perform plastic surgery. Like you really have to make sure that they're certified by the American Board of Plastic Surgery. So no, that's fair to assume that.
And I don't, only because I'm kind of embarrassed to look, but I haven't looked to check to see if he actually was. I know that the one for my breast dog was not a board certified plastic surgeon, but my nose has been something that's been really, really hard for me. But it's also like the surgeon that did it. I mean, even though I was unhappy with it. Like he was very, very nice and he was very kind. So I don't like to say like,
Okay, he had good
negative
bedside
stuff.
manner. It's just the skill
Yeah.
wasn't all the way there.
Yeah. And and that was really it.
Okay.
But he was, very nice gentleman.
Okay. And what made you kind of want to get your first rhinoplasty? Was it like the pressure of social media or the pressure of working in the plastic surgery world? Or is it kind of something growing up is something you wanted to kind of fix and alter?
So, excuse me. So, like in Korean culture, like plastic surgery is very common. Like a lot of young girls, like as soon as they turn 18, they get their nose their nose done, their eyelids done,
Wow.
everything like that. So, I mean, growing up, my family, they would like pinch my nose all the time, and they're like, "Oh, it just needs to be like this." Like it's just that's why Korean beauty is so good because beauty is such a big part of our culture.
Uh-huh.
It also can be very toxic,
Yeah, very
mentally.
true. Yeah. And you were born in the States. Where were you born again?
Well, in Los Angeles.
Oh, okay, you were born in
Yeah.
LA, but you moved. I
Yeah.
know we were chit-chatting. You moved.
To Marietta, which is more more inland, like down towards San Diego.
Okay. My goodness.
Mhm.
And at what age did you get your first rhinoplasty?
I think I was like late 20s, like 28 at the time.
Okay.
I was, in a very like unhappy marriage, was going to, I hadn't asked for a divorce yet, but like just growing up, like mentally, I've always had like, body issues and like,
Mm-hmm.
body dysmorphia issues. And, my looks were always the topic of conversation, my weight all growing up.
Mm-hmm.
And so initially I was doing all these things because I didn't like how I looked.
Mm-hmm.
And then, but sometimes I think what people don't understand is like you have to do and, go through these experiences yourself and mess up like yourself for you to fully understand and then
Yes.
retreat back. You know
Yeah.
what I mean?
Yeah. And we're definitely going to touch on like surgeries and regret. And I know you wanted to talk about that, but
Mhm.
that is huge. Sometimes you have to experience it all, sadly. But it's like with plastic surgery, sometimes things are not that reversible, right?
Right.
They're life altering things that you need to think about. It's not like dyeing your hair or getting your eyebrows
Right.
microbladed.
Yeah.
So we're definitely going to dive into that. We always hear people and nurses and surgeons that once you go past 2 rhinoplasties, perfection is nearly impossible. Do you agree with that now that you've had 3? Or what's your take on that?
I think you can get close, but no, with everything, no one is 100% symmetrical. I think except
Mm-hmm.
for like Halle Berry, they did like a thing, but like no one is, we're all, because I do, injectables as well for patients. And I'm just like, your muscles, like, you pull like stronger on one side, the other side, like they're not going to be twins, but we're going to go.
Try to be sisters.
Yeah, like strive for perfection, but just
Mm-hmm.
understand that it is never going to be perfect because we're
Yes.
always going to try to like find the next thing or the next thing. So just having that self-realization.
Yeah.
Nostrils, I know for sure with rhinoplasties. I mean, just anyone without a rhinoplasty, their nostrils aren't even either.
Mm-hmm.
Kind of same thing with surgical
Yeah.
is that they'll be close, but they're not going to be 100%.
And were you so scared this third time around? Like, okay, like this is the third time. This is kind of make or break. Like, if this doesn't go right, I'm going to crash out. Like, because
Yeah.
I would be thinking that. Like, you're almost more terrified the third time around rather than the first.
Yeah, 100% because my nose, it's in the center of my face and it's
Yeah.
been very debilitating because I do a lot of stuff on social media and like I'm on camera more now and I have all these other products that I'm working on where
Mm-hmm.
I'm on camera and I'm like I can't have the topic of conversation just be my nose.
Yes.
And it stopped me from doing a lot of things because I was like, I don't want to see myself. And it was just,
Mm-hmm.
and like, I feel like people can be like, well, yeah, that's your fault. And I'm like, it is my fault, but I'm trying to fix it. But I can't
Yeah.
just have surgery after surgery, like a week later. Like, I have to let it
It
heal
takes
and then I have to do it
time.
again. Yeah, it's a process. And people don't
Yes.
understand that because I, if I don't have to have surgery ever again, like, I mean, the healing process, it's not fun. Like, I don't want to
Mm-mm.
do it either.
Yeah.
So I'm doing it to fix my own mistake.
Yes.
And that's my own fault. And
Yeah.
that's,
And
yeah, and it's no one else's business.
I've never asked you this, but I want your take on it. Like being a celebrity nurse injector from Beverly Hills, they expect you to be
Mhm.
perfect. They expect you to know everything. And at the end of the day, we're only human, right? We all make mistakes. Do you ever have patients ask you or even like comments online, well, you're a celebrity nurse injector. You're supposed to know better. Like why didn't you do your research from the beginning? Like what's your take on that? Or what would you say to people who are so negative or nasty?
I mean, medicine and nursing, there's so many different departments and fields, and like,
Mm-hmm.
the body is so complex. Is like to know everything about everything in the body is impossible. That's why you have so many subspecialties. I let my patients know, like, I'm confident in what I know, and I'm also confident in what I don't know. And if I don't know something, I'm like, well, I can tell or get to someone that can get me the answer for you.
Yeah.
But I'm very transparent in regards to like if someone brings up a treatment and I'm like, I've never heard of it. I'm like, I'll look into it. I can ask around for you because I have those resources.
Yeah.
Um, I think, yeah, I'm not that type of person that's like, I know everything or I need to know everything.
And for background
So yeah.
info, Annie was an ICU nurse prior to this. You were like an
Mhm.
actual hardcore in a hospital bedside ICU nurse. And then you came into the world of aesthetics because that is kind of what you gravitated to after busting your butt by bedside for
Yeah,
so
it's
many years.
hard.
And you're like, I want to learn
I
aesthetics.
worked in the
So
ICU for eight
to be
years and I did
fair,
rapid response.
yeah,
And it's just, mentally, it's not normal for people to see a dead body, let alone like have to clean one up, like, maybe once, twice a day. So I just needed a better quality of life, but something still fulfilling where I can still help people, but in a different type of way.
yeah, definitely. And to clarify, when you got your first rhinoplasty, were you just making the transition from ICU bedside into aesthetics and plastics, or were you already in the aesthetics world for a minute?
I was just getting into it where I was like just shadowing at like a dermatologist's office. Like
Okay.
I don't think I was like injecting or anything yet. So I didn't know how kind of the
the whole plastics world, what it entailed, and the good surgeons and the bad, and what to look for, and what board certification really matters, and what does that entail. And even researching more than just your surgeon, like making sure, you're doing all the post-operative treatments, making sure you have licensed massage therapists, making sure just a licensed recovery home, like all the things. There's like a lot that goes into it, definitely. So for someone coming from ICU, it's definitely a whole different world and ball game.
Yeah, because I'm a nurse and I still didn't know that, because I guess in the hospital, hospitals are very regulated. So I just figured that so are these, quote unquote fake plastic surgeons as well.
No,
So, but it's
honey,
not.
as you
I know.
learned,
I
you
learned
can
the hard
have a
way.
whole private practice as a fucking ENT or dermatologist, and then you could be doing facelifts on the side with no board certification. It's
Yeah,
crazy.
it's insane. It's crazy. I don't understand it.
And there's a lot of ENTs in Beverly Hills that are doing lipo. And hey, some are great. Not going to give it to them. Some are great, but they think that lipo, it's like one of the easier procedures. Like, I could do lipo. I'm an ENT. I'll learn. I'll go shadow a big plastic surgeon, then start doing cases on my own. And then sometimes that's where you can run into problems.
Plastic surgery, the thing with plastic surgery, it's like it's an art.
Yes.
So if you're like, you can be very book smart, but like if you're not an artistic person, like Dr. Calvert, he literally drew my nose like on a piece of paper. He like drew my nose, like what it looked like right now, and then he drew it what he was going to turn into. And he is literally like, like
sketch
Picasso,
artist,
like, looking at me and sketching and everything. And I'm like he is an artist, and real plastic surgeons, like they're all artists. And it's not just like poking and prodding. Like there's shaping, there's everything. People just think that they can do it because they're a doctor, and it's not.
And it's a
not
cash
safe.
grab. Plastic surgery is a very lucrative money. There's money there. There's always going to be money there. So, they're an ENT who doesn't make as much as a plastic surgeon. They're like, okay, let me try this. I want to be in a Bugatti. Like, but like you said, there is an art to it. Not everybody can do it.
Right.
Yeah. So crazy. So crazy. Now, it's cost a lot of money to get all these surgeries, right? Your first rhino, how much did it cost ballpark, if you can remember?
It was, I think, 3 years ago.
Okay.
Yeah. So at that time, there was one in Boston I saw, and his was like 12,000.
Okay.
The guy that I used in the States or here was it was like around 14, and then the higher end one was 20. But that was a couple years ago. Now starting rhinoplasties are like 20,000. Revision rhinoplasties start at like 50,000.
And revision rhinoplasties, oh my goodness, they will charge you an arm, a leg, and a kidney, girl. Like, it is so crazy because to touch another person's work, it's like, no. So, and that's, on another podcast, we were talking about like plastic surgery is a lot of money. You really have to save up for the pre-op care, the post-op care. And hey, sometimes you need a revision. You might need a little bit more money in the bank a little bit later on to get a revision. Like, always have that in the back of your mind, because there can be a complication, whether that's intra-op or post-op. So did you have to pay for this revision? Because I know you work with Dr. Calvert. I know you're his nurse. Can you did you just only have to pay for anesthesia, or did he give you a discount?
He gave me a really good deal. I did pay money. He did give me, a really good deal, and he knew like how debilitating it was. He was just like my savior with that whole thing, because the original cost of what my surgery would have been easily like $60K or something like that.
It could have been for your revision.
It could have been.
Imagine, and then you already dropped like $15,000 on your first one. Like, if you add all that up, girl, that's some serious
that's just my
cash.
nose. Yeah,
and you had yes,
yeah, and my boobs.
Oh my God.
Yeah.
So crazy. Now, when you got your breast dog, what year was that, and how much did you pay for your breast dog?
The amount is crazy because, and this should have been a red flag, it was only $5,000, and there was saline. I know that was the first red flag.
I mean, I paid $8,500 for mine, but I got mine done in West Hollywood. $5,000 giving a little bit of Tijuana mama, but I mean,
yeah. But like with that one, that was, I think, like either 2 or 3 years ago. A lot of the first surgeries, they were kind of all within like the same kind of time frame.
Yeah.
But the crazy thing is, so when they took out my old implant, so I have the Motivas in now, which are so much more comfortable. But I had saline. But when they took out my old implants, one of them was deflated, and also there was like stuff growing inside it,
like mold in your implant.
Yeah, can I show you? I have it.
Pull them out. Pull the girls out.
Okay, so these they both say 500 on them, but they're clearly not 500, both of them. Like, do you see how like one is bigger than the other?
Yes.
And then look how gross I was like, this was inside my body. I was so grossed out. Like, can you see like the things floating in there.
You have foreign little objects floating in your implant that was just taken out of you a week ago.
Yeah.
What the actual hell?
I don't know. I was really upset about that because I'm just like, what if I already had a capsule on one side.
Yeah.
From it. But then with that one, I was just like, what if I got sick? Like,
what if you got sick?
It
What
was
if it
slowly
ruptured?
leaking.
Yeah. And all
it's
that
just,
shit's just going in you.
I don't know what it is. I have no idea what it is.
Did Dr. Calvert have a theory, or is he like, what the hell is this?
So I guess, don't quote me on this, but I think he was saying like there are some types of implants where you can like fill them up more, like for saline
that's
ones
like
where you can
really
fill
old
more.
school.
Yeah. And so I think he was saying like maybe some
They
leaked
grabbed
and then some tissue got in there or something or whatever.
I'm over here thinking that they just had a bowl of saline that they were rinsing out and they grabbed it from there instead of like clean, sterile saline.
Honestly, like who knows? Because even like see how it like is like rippled, like I don't know if I can show it that well, but it's like kind of like rippled right here.
Oh, like a water,
like a divot. That's what it felt like. Like I could feel that like inside my boob too. Like so that's why I needed to also get him fixed. And I got a lift as well.
Goodness.
Yeah.
That's crazy. And you got your first breast augmentation in LA as well. Did you get it by the same doctor who did your rhino?
No, the breast aug, that was in San Diego. So it was a different one.
Okay. You got your first breast augmentation in San Diego. And then Dr. J. Calvert did your revision breast aug.
Of both of them at the same time.
Yeah. And I remember when we were out eating, you were like, I think I want to go bigger. What did you end up doing? Did you go bigger? Did you go smaller? I know you got a lift.
So Robert was telling me that like the Motivas, the highest they make is 625. And the implants that I had were 500 or 550. I was told like they didn't tell me the right one, like the original surgeon. So I did 625, which is the biggest Motiva that they have. But I'm able to carry it because I'm tall and like my shoulders are broad and everything.
You do have broad shoulders because 625 sounds crazy.
It sounds crazy. Yeah, it sounds insane. But for me, because of my height and like, you know, my width and everything.
Yes. It's proportionate to your body.
Yeah. And that's why people like, you know, when the whole Kylie Jenner thing came out and everyone wanted like 400, it's like, it's not going to be the same for you as it is for her or for anybody. Like, don't focus on the number.
Yeah. If there was a girl who was a smaller frame, who was shorter, with like not as broad shoulders, and they got 625s, girl, you might be looking like an OnlyFans girly, but
yeah, those would be insane.
Yeah,
she rocked it, whatever.
Yeah, but you are taller, you have broader shoulders, so I'm sure it fits you. And you did want them a little bit bigger, so that's the look that you were going for.
Yeah, because I'm not trying to look super, super natural, but I'm also not trying to look super, super fake. It's somewhere like in the middle, you know?
Same. That's when I got mine. I want you to know that I got them done, but I don't want them like out there crazy. If I want to make them look crazy, like I can, or I can still downplay it and they still look, you know, like I got them done, but not too crazy.
Yeah, you paid a lot of money for them, so it's like I want people to know.
And it's so funny, honestly. Like it was like when people get their lips done, and sometimes the girlies, you know, the Kylie Jenner lip era, King Kylie. Girls were going crazy. There were 2 syringes, 3 syringes, like going at it. And I was like, oh my gosh, like, why do they want it? Like so much filler in their lips. And I'm like, wait, I get it. It's because like the girls want people to know, like, I got lip filler. Like it's the same as a breast aug or it's the same as a BBL, right? It's like, I'm spending all this money. You're going to know I got something done.
Yeah. No, that's for sure. We're actually fixing a lot of the old Kylie Jenner lips now because the filler that we were using like migrates so much. It was a lot of Juvederm Ultra Plus. Super thick, like, also very absorbent, like, and so we've been fixing a lot of the old style of that lip. Yeah, is what I found. Crazy.
Everyone's in their like Hailey Bieber natural era right now. Clean girl aesthetic.
I still love my bigger lips, but
yeah, to each its own. Now, I do want to talking about lips and everything. I want to talk about beauty standards and pressure. Do you think Beverly Hills pressures women into overdoing it, even the nurses working in the field? Because I have worked with some nurses that, you know, a lot of nurses have work done, whether it's a breast aug, a rhino, a BBL, and some nurses I'm like, okay, girl, like, all right, what's happening here? But do you think that there's like this pressure in Beverly Hills or even working in like just a plastic surgeon's office that you have to look a certain way?
I think if you're going to, and I'm trying to say this in like the nicest way possible, like if you're going to work in an industry where it's about beauty, like, you need to look a certain part, not a certain like look per se, like a carbon copy of like the same person, but like you have to be pretty, you know, and you have to, you know, hold yourself together well. Because if you're trying to tell me to spend, you know, $1,000 on Botox when your face is all wrinkly, I don't believe you. Like I'm like, well, why don't you do it if that's the case, you know? So it's like, It's very much like
Facts.
you have
No,
to
you are
practice what
speaking
you
facts.
preach.
Preach.
And it
Yes.
sounds so
Oh my
vain.
gosh.
And I'm not trying to say it in a bad way, but it's like if I don't know, you had a hairdresser with like no
Bad
hair
hair
telling you that, yeah,
or
or
no
something.
hair
It's just
telling
right,
you need
exactly.
this $5,000 keratin treatment and you need to do this. And you're like, but girl, like, you're not even
Mm,
following your own treatment plan.
yeah.
So I get it.
There's
Yeah.
there's definitely, kind of things that you have to understand when you go into this industry. Like you're going to be, criticized for how you look. Everyone's going to be looking at you. You have to look, put together. It's just one of those things that, like, if you want to be in this industry, you have to have tough skin, and you need to just understand that that's going to happen.
Now, looking back, you said this to me. I did not say this. You always said that you looked crazy. And what exactly did you see or make you feel that way when you refer like, oh my God, I look back at my old photos and I was out here looking crazy?
I was At the time, I was in a very bad place mentally, and I was just like, any change is good change.
Mm-hmm.
So I felt like I was so overfilled. My brows were spocked. Like it's, I'll send you a picture. Like it was not cute. It's funny now because when people are like, you have filler blindness, I'm like, I have maybe 3 syringes of filler in my face in
Mm-hmm.
total. Like I've gotten so much of my filler removed, like I looked insane. Like my lashes were like really, really thick too. Like,
Yeah,
and it's
you were
just,
just trying to do too much all at once and all over.
yeah, because I was trying to make myself feel better because I was going through other things that I was like unhappy about, just like
Life
other
was
personal
lifing.
stuff. Yeah, for sure.
Yeah, and you were just trying to do everything. Oh my goodness. And do you
Hmm.
think that even with having a little bit of body dysmorphia also kind of fueled that fire? Like you already had body dysmorphia growing up and then life was lifing for you and you're like trying to alter things about yourself to make you feel a little bit better. And ultimately, like you were like, no, like this isn't working.
I think too, because doing different things to, my face or whatever, it was like one of the very few things that I was able to control or have control over. So I think that's also like
Yeah.
another part of it. But with the whole body dysmorphia thing too, like I look at old pictures of myself and so before any of the filler, before any of whatever, and like I do get sad sometimes because I get
Mm-hmm.
sad that I was so like, hold on, I get emotional 1 second. I get
Oh,
sad that I was like so mean to that
that
girl.
you're that girl.
Yeah.
Yes. And
And
just being so hard on yourself. And it's like, why? Like, look at how pretty I was. Like, why was I bashing myself so hard? And we are our own biggest critics, which I
mhm.
hate that we do that to ourselves, but it's hard.
I think just also just Korean culture too. It's like,
Mm-hmm.
the beauty standards are unachievable, and that was just also a lot. Like I was a little bigger, like my sisters, like they were both really skinny. And it just, yeah, no matter, I was on a diet since I could remember,
Oh,
so yeah. But I've gone through like, my own journey and I've made a lot of my own progress, which, people don't understand and they don't see. And that's okay because it's just my progress and stuff. But like I used to not even leave the house without makeup on or my hair done or anything like all glammed
mm,
up. But now I just like go out and whatever. I just have sunscreen on and I'm like, I'm good to go.
yeah. And what would you tell like other women or young girls, and especially maybe those that are Korean, like when they're dealing with the same thing, like, oh, my parents are saying this, or the Korean beauty culture is saying this. What would you tell them to help navigate that? Or I should ask you, what would you tell your younger self?
Yeah.
Like looking back in retrospect, like you shouldn't have conformed to those beauty standards, or you wish you would have waited on certain procedures and really thought more, or maybe just not getting anything.
I think just be like just, just be like kinder to
Mm-hmm.
yourself. And because when I was younger, and I had made a post about this, but like every summer I go to camp and I was always excited to go to camp because I would lose 10 pounds every summer. And this isn't, I'm 11 years old. Like no
Oh
11-year-old should be
my
thinking about this,
gosh. No.
but we would sleep under the stars and there were shooting stars. And every time there was a shooting star, I was like, I just wish I could be pretty. And I had a picture
Mm,
of how I looked in my head and that's how I look now. And so it's kind of like, I think if like you're unhappy with something and if you're really unhappy with something, you don't need to be stuck with it. Like you can change it if you want to,
mm-hmm.
but don't rush into it and just really think about it and, do your homework, do your research and just, keep in mind that some of these things are permanent and some of these things you're going to have to get provisions of and it's going to be a long process. But I mean, overall, like how I look is how like the little girl version of me like
Was
wanted
imagining your
was
future self.
imagining. And so that
Yeah.
that part kind of like gives me some peace and like and everything.
Yeah. You just had a couple trials and tribulations along the way and some learning, some growth pains, with altering things. But I'm glad that you're
Mhm.
really self-aware and you've made it this far. And also that, yes, you're a plastic surgery nurse, but you were a patient and you were a girl suffering, with body dysmorphia, and that you can actually speak on it and you can share
Mhm.
your journey to help others.
Yeah, for sure.
And what's also tough is like, on social media, the views go up, it gets on the For You page. Your video goes into the wrong hands. And a lot of people
Mhm.
are just seeing that one or two videos and they're like, oh, this girl, she's from Beverly Hills. She's pretty. She's just vain. That's why she's getting her 3 rhinos and 2 breast dogs and filler. But a lot of people don't know the backstory of like why things started to happen. You were going through a divorce, the Korean beauty culture, being a little girl and being told that you were overweight. Like all these things play a part.
Mhm.
And then people just go make a nasty comment, but they
Yeah.
don't know the backstory. And it's like, you guys, like, what the hell? First off, why are grown ass men commenting on your page? I always say this. Like, and
Mhm.
two, it's like, this is why you shouldn't comment anything nasty at all, especially not knowing the backstory.
Right. Yeah. And also too, like the other thing I'm getting used to is I've never been the hot girl before, except
That's hard
for
to believe, mama, because
well, for me to like to accept it, you know what I mean? So
yeah.
but what comes with that is like people assume that like everything is so easy for me, that things are just handed to me, that like
Mm-hmm.
all of these things, like it's really weird because I'll go out in public and I was at a concert and there was this like older woman sitting next to me. She's like maybe in her 50s or 60s, and she's like talking to me, talking shit about everyone, all these other girls' outfits, and I'm just like, do you think just because I look like this, like I'm a mean girl and I want to talk shit about people with like it was so odd, it was so
Yeah.
weird, but it's like I don't know, just the world is weird right now. And I just use the mean comments, all that stuff. It helps with my engagement, social media, whatever. And I
I
just
know
use it to
you
my
made
benefit.
a story today. You were like, yeah, like you guys are talking all this shit and commenting nasty comments, but look at my engagement. You guys are throwing my video out there and it's getting more and more
Yeah, I got
views.
400 followers for, like this past weekend just from people saying mean things about me. So
I
I'm
mean,
like,
engagement
whatever.
is engagement, but sometimes the nasty comments, I mean, most of the time the nasty comments do hurt. And yeah, they
Hmm.
might not affect you right now, but maybe like 2 weeks from now, there could be girls on the internet like, but this person said this about me. Maybe like it'll sneak back up even if it doesn't
Yeah,
affect you while you're reading the comment in the moment.
yeah, for sure.
Annie is 1 week post-op and she's been on her phone, and even
I
your doctors were like, put your phone down. She's in bed and she's recording
am.
herself, replying to nasty comments, nose cast and all, sounding stuffy. And I was dying. And even at some point, I was like, if this girl don't put her goddamn phone down, I'm like, go over
I
there.
know. Well, I was
But
trying to give people like the full, like, this is what you're gonna like, what you're gonna feel like after your first day or your second day or your third day.
she's all vlogging her
Um,
whole journey, but also responding to trolls.
Well, I'm just, I'm giving them the attention that they want because they literally have nothing better
Yeah.
to do because I'm just sitting at home healing. So I'm like, let me give the people what they want right now.
And what are these losers saying? Like, what's the number 1 or number 2 comments or DMs that you're getting right now about whatever?
A lot of them are on older videos of my nose, Michael
Mm.
Jackson, blah, 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 all this stuff. And it's always 99% of the comments are about my nose. But you know what? What the funny thing is like my weight was always the biggest issue for me. And,
Hmm.
no one has said anything about that, which has like been really nice because that one might have hit home, like, been a little bit harder.
Yeah.
That I'm like, I think that they people just assume that I'm a certain way, like my personality, I'm stuck up, I'm whatever. And
Hmm.
I feel like if they really met me, like I'm the complete opposite of
You
that.
are the
Like
complete opposite. You are like down to earth, like
I'm such a
chill.
goofball. Like, yeah,
Yeah, you are
I
not
don't
that.
know. But yeah,
So
honestly, it's mostly the
annoying.
nose. It's mostly the nose that they talk about.
And are you deleting comments or are you keeping them? Because I'll delete. I'm the first to delete real quick because you're not going to bring that negativity onto my page. Or even like negativity of commenting on podcast guests. Like I had a nasty
Mm,
comment a couple days ago on one of this, like 2 episodes ago. And I was like, what the fuck? Delete. I didn't even give you
yeah,
5 minutes on the page. Absolutely not.
I do block a few of them. There are some that are, very like inappropriate that I will
Mm-hmm.
block, but then they'll make, and like, it's so funny because some of the accounts that comment, because you know how now you can see if it's a new account.
No, I didn't know
You,
that.
yeah, you can see if it's a new account, like if someone just made it. I'm just kind of like,
Oh,
you
then
guys,
you're
like
just suspect
you
as
care
fuck.
about me so much, you made a new Instagram just to talk about me.
Yeah, that's suspect as fuck.
Yeah, it's weird, but just I don't know. I'm so happy with my life, and I'm just glad that because I don't people like that I don't understand. I'm so grateful. My brain doesn't, think
Work
like
like
that, and I don't
that. You're
understand
not a
that. And
nasty individual with no life.
yeah, and I'm just so grateful that I have the life that I manifested that I'm living, and I feel bad for those people who feel the need to say those things to make themselves feel better. And if they ever wanted to come into my chair, like I would be more than happy to treat them and talk to them. Like and
Because
stuff.
Lord
And
knows
then
they probably need some work, child.
I've had people, dude, literally talk shit about me 2 years later, 3 years later, DM me and saying, hey, like asking me questions about Botox or whatever. Like in my head, I'm just kind of like, but then I respond, I'm like, yeah, girl, like this is like I'm giving them the advice and I'm just like, because I don't know. That's just how I am, I guess.
Yeah, it's like I don't know how I don't know how I would respond if I saw someone talking shit about me on social media or whatever, and then like coming to my plastic surgery page and be like asking for advice or asking for help or wanting to get something done. I mean, I get people change. People do change. Like a lot of girls were nasty in high school and now they're cool because like they were going through some shit or they had mommy or daddy problems, whatever it is. But I don't know if I would be like cool with them like that.
I think my divorce and having to heal from that whole thing, like, and then and just like with my dad passing away like all around the same time, like my perspective of thinking has changed a lot. And it's like,
Yeah.
if someone is saying these things about me or to me, like mean things, like I'm not taking it personally. Like there's a reason why they're doing that. And it's like a deeper reason that
Yeah.
I don't know about. So just I'm trying to give them grace for that.
Yes.
And that's how I just like stay at peace with it, basically, if that makes sense.
Yeah. And that's a good way to look at it. That's a healed girly for you right there. Now, a little
Almost
bit of a
healed. I mean,
rapid
like physically.
Oh yeah. Emotionally, spiritually, physically, we're getting there. We're getting there.
I know, we're getting
Now,
there.
a little rapid fire. If you could erase one surgery from your past, which one would it be? Like, hell no, I ain't doing that shit again, or I shouldn't have done it.
My first rhinoplasty, just because it's been a pain in the ass.
Yeah,
But
you're
I
like,
mean,
I
I'm
just
happy
wish.
now so far, but just yeah, probably the rhinoplasty.
Okay. What's one procedure that you would tell the girls or anyone to never get? Like, do not waste your money on this shit. It's a scam. Hell no.
Threads,
Oh,
the
the
facial
PD.
threads, the
Yep.
PDO threads.
All
Such
the
a waste
girls
of
trying
money.
to achieve that cat eye look.
It's such a waste of money, and for how long, like for how much it is, and how like not long it lasts. It's a waste. Like, and it's yeah, no.
Seriously. And that was like a set that was going viral, like what, 3 years ago? Everyone was doing the PDO threads.
Well, it's
Like,
like what, $5,000 for like a 3-month result is crazy.
that is crazy. That is too much. Absolutely
Hmm.
not. Fuck
Yeah.
no. You better just save up like a year worth of PDO threads and then you can go get like a mini weekend facelift and
No,
just
exactly.
be snatched for a hot minute.
Right. And then
Oh
they're
my.
like, the collagen benefits are for a year. I'm like, no, that's all bullshit. Like, it's no, no, no. So yeah, probably threads. I'd be like, no.
Seriously. Okay. And you talked about Real Self and the websites like that. They aren't the move, but so many people fall for them. I have heard great things about Real Self. Do you think that and I always tell girls, wherever you get do your research from, kind of take a little bit from everywhere. Don't just rely on one. Like, just don't rely on YouTube vlogs. Don't just rely on Google reviews. Like, really do your research on one. Do you feel that way about Real Self? Like, take a little bit of research from it, but still do more, or don't use it at
Yeah.
all?
Yeah. So I think the best way to do it is, find a couple surgeons, go on their Instagram, because every surgeon is going to have at least one or two patients that are very transparent about their recovery and their
Mm-hmm.
surgery and everything like that. So, looking at their Instagrams and like just even DMing them, like I get DMs all the time just about like, I want to get this, like, do you have a recommendation for this? And it's like, I don't know these people, but it makes me sad that like I'm the only safe person that they feel
I
like they can
know.
ask.
And then you got to help the girlies out.
Yeah. So I think so, like find the surgeons, like dig through their Instagram, see that the account that's tagged of the patient, because there's always at least one or two that will let them, have their surgery be public
Mm-hmm.
and whatnot. So I think that's the
Going
best way to do
going
it.
straight to the source, finding a patient from that surgeon or a couple and asking, how was pre-op? How was surgery? How was post-op? How far along are you? Like, you know what I mean? I think that's a great tool. That's one of the best research tools that you can
Hmm.
use.
Yeah.
Definitely. Now, with your rhino, I know it's hard to say. Do you think as of right now, like all is well and you love your nose and this is it? Like, this is the final surgery?
Dude, I cried. I cried when I have a video of it. I cried when the casket
Okay,
came
that's like,
off, and it's funny because it's like because it's still so swollen, so it's like it looks kind of
yes.
funny still, but you can just tell that like when I'm looking in the mirror, before my nostrils were staring at you, and now they're just, they're not, they're more down to the ground. I've been feeling more confident, and I've been doing more like just kind of like photo shoots and like modeling things, and I wasn't doing it because of my nose. And I feel like, once my nose heals and everything, that I'll be
Mm-hmm.
able to do those things. And that's my way of healing my body dysmorphia, is like putting my body out there and love it
Yes,
because I
getting
love it.
out there and trying new
Yeah.
things. Yes, queen. I love to
Yeah.
hear that. I
So
know
so
when
far
you
I'm so happy.
Yay. When you messaged me like a month ago, you were like, all right, like I'm going in for my third rhino, my second breast aug. I was like, please, Lord Jesus. I was like, please have her get a good result, a good outcome, because I know she's going to crash out like anyone would
Mm-hmm.
if this doesn't
Yeah.
go as planned. And I was like, I know how bad this has been affecting you and how much you wanted it. I was like, please, please, please let her have a great result. So I'm happy to hear that like you're in love with it. And even though it's early on in your recovery, like you can definitely tell.
Yeah, it's
That's
still so much better. And I'm just excited that it's not something that's going to be holding me back or be the topic of conversation anymore.
yes.
I mean, I'm sure people still are going to say mean things, but whatever. It is
Yes.
what it is.
And what about the girls? I know you got a lift. Did you get a donut or did you get an anchor lift?
I did like a full on like mastopexy. So it's the like it's the anchor.
Okay.
So like, yeah. You know what's weird is I think it's because it's above the muscle. But my boobs like did not hurt at all. Like
Oh.
if my nose, if I didn't have my rhinoplasty and if it was just my boobs, I would have gone to work like the next day. Like it was totally
Wow.
fine. But you know why? I think it's because I already had like the tissue was already stretched out from the
Yeah.
previous implants.
Mm-hmm.
But yeah,
It wasn't
boobs
that
are
much
like,
to stretch.
yeah. I didn't realize my nipples were like low. I didn't realize how low they were. They were like,
It was low
like,
to the flow?
yeah. And I was like, oh my God. And then I remember I told my best friend, I was like, I didn't realize how low they were. She's like, yeah, they're a little low. I was like, why didn't you tell me they were low for?
She's like, just a tad, sis, just a tad.
Yeah. So now they look at you. So now they're like eyeballs and they look at you. So they look good. I'm so excited for the summer. I'm so excited.
And are you going to be doing some scar treatments? Did you have your scar tape or gel? Because I know a lot of girls get scared about getting a lift because of the scars, but how do you think yours are going to turn out?
I'm not sure, to be honest, but I'm thinking because it's an area where it doesn't get a lot of sun. So I think that'll be easier to help with the healing. And then again, I'm so lucky and blessed to be in this industry because if I wasn't, I would not be able to afford all the things the maintenance and whatever. So I have all the lasers, I have everything that I need. So the scars are like the least of my worries right now. I just want to make sure that I heal, appropriately so I don't have any complications like the last time. And then I'm really fortunate to work in this industry to where I have all the lasers, microneedling, anything that I need to help with the scarring to deal with later. So I'm not too worried about it. But silicone, like the strips, like I heard are really good.
Yes.
But yeah, I'm like, we'll deal with that part when we get to it.
Well, I'm so happy that your rhino and your breast aug turned out so good. And Dr. Jay Calvert is amazing. And it's a blessing that you get to work with these amazing board certified surgeons as well.
Yes.
And I'm glad that this time around, girl, you followed those post-operative instructions. That's what they are there for, as you know.
I know. I'm so happy. Yeah, I'm very happy. I'm so grateful. And regardless of the trolls or whatever, like, this is the life I've manifested and I'm totally at peace with it and happy.
Yes. And I'm so excited to see that we're almost, a couple months left of the 2025 season. And then like next year, what's in store for you and you just coming out of your comfort zone. And it's going to be so exciting to see your transformation and what you do and all the work that you will do as a celebrity plastic surgeon, baby. Celebrity plastic nurse.
Nurse. But no, there's some products I'm working on I can't talk about yet, but I'll text it to you. I'm really excited and the future is looking very bright and I'm just very happy.
Ready. Yes, a new era is unfolded. And if anyone wants to go to Nurse Annie's page or even book a consultation with her, or go get Botox or filler or whatever your guys' heart desires, we will definitely be collabing with her. And you can go over onto her page to see her surgery journey or just to see the great content she puts out as being a plastic surgery nurse.
And any questions too. Like,
she'll answer questions. Definitely. So I'm so glad we were able to record this podcast again.
I know.
And I have to have you on like another time as well. And maybe we can get into like hot topics or trends or whatever it may be. So that'll be fun and interesting. But thank you so much, gorgeous. I appreciate you for coming on second time around and just sharing your journey and being so open. I love it.
Yeah, for sure. Thank you so much. But I love you and I want to see you soon. So let me know when you're back in LA.
Yes, we will get back together. Oh my God, side note really quick. I don't even have time to be telling the story. But me and Annie and another nurse Yvette, we went to get dinner a couple weeks ago and I asked her via DM. I was like, hey girl, like, because we were going out for my sister's birthday and I was like, hey girl, like, do you want to go to ballet tonight? And like, it'll be fun. It's my sister's birthday. And she's like, oh my God, the ballet? Yes. Like, I'm so down. And I was like, okay, like we're pulling up at like 10:30, like, we're going to the club. And she goes, oh wait, that's kind of late. She's like, wait, like a real ballet? I said, girl, no, we're going to ballet the club.
We were going to a ballet show.
I said, that's cute. I was like, there's not even a ballet in LA. Like, where is there a ballet show in Los Angeles? I was like, no, girl, I'm talking about the club.
Oh my God, that one. Yeah. That was funny.
I was dying laughing that she really thought I asked her to go to like a ballerina ballet. That shit
I
was
was
so
so
funny.
excited. I was like, I've never been to a ballet before.
She
I
was
like,
so
"That'd be fun to
excited. I
watch."
like broke her heart when I told her it was the club. We're trying to go get ratchet. She was like, respectfully, no.
I know. I was like, I'm tired. Well, we should find a ballet and go to one.
Okay, maybe during Christmas. I feel like there'll be like the Nutcracker or something.
Yeah, for sure. Okay.
All right, baby doll. Well, I will definitely be in touch with you guys. I mean, with you. And thank you guys for listening to another podcast episode of All Things Plastics. We will talk to you girls next week. Bye.
Bye.